Hi, this is Dr. Sam Benjamin, bestnewportdoc.com. Twitter account, same thing. Instagram, same thing. Want to talk about B vitamins, want to make it brief. You don't have a lot of time, neither do I. B vitamins. They're being prescribed sometimes when appropriate. For example, if you're a diabetic patient, you're taking metformin, B vitamins are often depleted. Your doctor may, for many reasons, prescribe a B complex or B vitamin complex so that you can pick up for the depletion of B vitamins that may be occurring with your consumption of metformin as a medication. However, people are overusing this a lot, and you docs listening now, you providers, PAs, nurse practitioners, you need to be thinking about this a lot. There are numerous studies showing that B complex can result in myocardial infarction, for example, in diabetics. I should say better yet, it can result in an increased risk of getting a heart attack. So, for example, it's been assumed that because homocysteine levels are high in diabetic patients, and homocysteine levels are associated with heart disease, that if you lowered the homocysteine level, therefore you would lower the risk of heart disease. Treat the number and you will make people better. So people were given B complex, which has niacin in it, and the niacin helps, amongst other things, helps lower the homocysteine level, and guess what? Instead of decreasing the risk of heart disease, it actually increased it. This is particularly important in patients who are diabetics who have kidney disease, CKD, chronic kidney disease, because this risk is yet even higher. Now, B6 and B complex, or better yet, how about B6 and B12? They're being associated with increased risks of hip fracture. That's very important. So patients who are taking a lot of this stuff are getting increased amounts of hip fractures. Now, whether or not there's associated osteoporosis, I don't know, but the tensile strength of the bone is decreased. Now, what's important about this is you say, oh, I don't give a lot of it, or my patients don't take a lot of it. They don't. I wouldn't be so sure about it. Multivitamins have B6, B complexes, they have B12 in it. But not only do the multivitamins have them, so many of the supplements that patients take, and they take multiple ones, and the supplements in particular will oftentimes have needless or gratuitous B vitamins as well as other vitamins and minerals in them in order to distinguish themselves from yet other vitamins. So instead of just taking, for example, hawthorn berries to dilate blood vessels, they'll have hawthorn berries and 4 or 5 other gratuitous things added in so that it looks like there's something special about what they're doing. In the meantime, you add all of that up, plus what people are getting in their diet, they're getting too much B6, too much B12. No reason for people to be getting B12 injections unless there is some specific reason that they won't absorb it. Oral B12 does fine, and they may not need oral B12 unless there's a real reason for that as well, if they have a real B12 deficiency. So my advice, avoid giving too much of anything, but for right now, taking B vitamins, it's not as simple as it seems. You need to talk to somebody about it. If you're a provider and you don't know enough about it, you're welcome to call me, message me. I'll be glad to help you out if I can. If you're a patient, call me, call your doctor, call whoever you want, nurse practitioner, PA, but don't just take things and assume that they're safe.